po si Abe, isang mag-aaral ng medisina mula po sa UP. Narito po ako ngayon upang magsagawa ng eksaminasyon sa inyo pong batok, leeg at balikat. Sige. Kumusta naman po kayo, sir?
Okay lang naman po.
Okay po. Wala naman po ba kayong history ng trauma sa inyo pong leeg?
Wala po.
Lagnat po ngayon, wala naman kayo
Wala
lagnat?
po.
Nagtitake po ba kayo ng steroids?
Wala po.
Okay po. Meron po bang history ng cancer?
Wala po.
Or weight loss, sir?
Wala po.
Okay po. So ano po ikinonsulta nyo ngayong araw, sir?
Alin?
Ano po ikakonsulta ninyo ngayong araw?
Sumasakit po dito sa batok ko, tapos nahihina po dito.
Yung balikat.
Yung balikat ko.
Okay po. Sige po. So sir, para po malaman natin kung ano yung problema, may gagawin lang po tayo mga test sa inyo. Para malaman po natin kung yung problema po ay nasa inyong leeg at naapektuhan lang yung balikat o pareho po may problema. Ang tawag po dun sa test ay Spurling's test. So okay lang po ba sir na gawin po natin yung mga test?
Okay lang po.
Sige po.
The patient presents with a chief complaint of knee pain and deltoid weakness. To assess for cervical radiculopathy such as for aminal encroachment of a nerve root, we perform the Spurling's test or the neck compression test. This test aims to reproduce radicular pain in the neck region. Before we proceed, make sure to exclude serious conditions and the following red flags. Before starting, make sure that the patient's shoulders are aligned. Then, let the patient sit in a chair comfortably. The examiner should stand beside or behind the patient and not in front. Palpate the nape of the patient first to check for tenderness. If tenderness is reported, consider cervical strain or sprain or cervical myelopathy.
Hawakan ko lang po, pipisilin ko po ang inyong leeg. Sabihin niyo lang po kung may masakit, sir po.
Ano po?
Ito, sir, masakit po?
Wala po.
Okay po.
An important precautionary measure is when the patient feels a shock-like paresthesia upon neck flexion. This is what we call the Lermitz phenomenon. If this is positive, do not proceed with the Spurling's test. This is suggestive of a cervical cord compression or multiple sclerosis.
Tapos sir, i-check lang po natin, iyuko po natin yung inyo pong noo. Okay lang po? Sabihin niyo ako sir kung masakit. Masakit po?
Wala po.
Okay po, okay na sir. Natin. Okay. So yung last na test natin sir is yung Spurling's test.
This test is performed by keeping the head in a neutral position. Using one hand, gently extend and laterally flex the head to the affected side. Hold the head down for 1 minute. Stabilize the shoulders by pressing it down with the other hand to elicit an electric shooting feeling. This is a Spurling's maneuver.
Ay, may masakit po ba sir?
Masakit dito. Tapos parang may kuryente dito. Pumunta dito sa dulo ng daliri ko.
Hanggang sa dulo. So, simula po dito hanggang sa dulo ng inyong daliri. Okay po. So our patient has no pain upon palpation and is negative for Lermitz sign and positive for Spurling's test.
A positive Spurling's test is when the pain is present beyond the shoulder, but neck pain alone is non-specific. This maneuver is most likely to provoke symptoms in patients with foraminal stenosis, central stenosis, or disc herniation involving the foramen. These tend to be the most common causes of radicular pain. If pain is localized from the shoulder to the tip of the fingers, the problem is in the cervical spine. If the pain is localized from the shoulder to the elbow, the problem is in the shoulder region. The Spurling's test is highly specific for the presence of cervical root compression, but it has variable sensitivity. Thus, a positive test is helpful, but a negative test does not rule out radicular origin of pain. For the patient's case, since the patient felt pain from the shoulders down to the tip of his fingers, a probable cause of his nape pain would be a root compression of the C5 and C6, which also innervate the deltoid muscle. The patient's deltoid weakness can therefore be a consequence of the cervical root encroachment or a give-way weakness because of pain.
So, maraming salamat po, sir.